In the modern day lifestyle and the digitally driven world today, health and wellness has become a primary concern for everyone. Moreover, major health issues are escalating in the communities due to population explosion, environmental pollution, unhealthy food habits, lifestyle, and many other such global and local factors, including climate change. It is not possible for the prevalent medical sciences and healthcare practices to tackle these challenges, especially in ensuring public health.
As physicians, we deal with the health of a person or a patient one at a time, several maybe in a month. But when we think about public health, we are dealing with the health of the population, the entire community around us. And it's a science much more powerful than medicine. We reduce morbidity and mortality literally in millions.
In fact, we can save millions of lives. Those are impacted due to the challenges being created in the areas of mental and socio-behavioral health, diabetes and hypertension, cancer, road accidents, and many more. Public health can be the answer to develop awareness among the people and build the right mechanism to prevent such mass distress.
The incidence of cancer in India is 1.7 million. Out of this, majority present in advanced stages. But one factor which is important is that 60% of these cancers are preventable, 40% being tobacco-related cancers, and 20% being infection-related cancers.
Public health is all about protecting and improving the health of people and the communities where they live, learn, and work. This objective can be achieved by continuous surveillance of chronic and infectious diseases and promoting health of people by research and innovation on an ongoing and systematic manner.
I came to Odisha. I asked the question, why the babies are dying due to infection, what time. Nobody had done that surveillance. It takes a lot of time, a lot of money, a lot of perseverance to do it. You can't do it inside the hospital. You have to go out. We have 350 villages, 350 people working. And then once we find out what the cause is, then we have to have a solution. So we take that problem, go back to the lab. Then again in the lab we have sophisticated instruments, we have techniques, technologies, we employ them, work on them for several years, then we find a possible solution, not that it is a solution. Then we bring it back to the same community, test it and see whether it works or not. And sometimes it does, sometimes it doesn't.
In order to address the need, Dr. Pinaki Panigrahi, a non-resident Indian physician and an internationally acclaimed infectious disease and public health expert from USA, had chosen Odisha as his laboratory long back in 2001. Along with him joined some of his American colleagues and card-carrying experts from India. To take the mission forward, Dr. Panigrahi collaborated with the Government of Odisha, Indian Council of Medical Research, Ministry of Health, Government of India, the National Cancer Institute, Delhi, and many international organizations.
I first came to India more than 15 years ago with Dr. Panigrahi to set up the first neonatal nursery in Odisha at Capital Hospital. I have been involved in AIPH since its inception, and I feel that it can become a center of excellence in public health, both in India and in the entire region.
As a result of the intense research, Dr. Panigrahi and his team hit the headlines worldwide. The probiotic methods which he discovered has the potential to prevent infections including sepsis, a deadly infection that kills about 1 million babies around the world every year.
It feels like only yesterday that I began working with the Asian Institute of Public Health in Bhubaneswar. We were the first group to investigate neonatal sepsis and the role of preventing neonatal sepsis. I continue to work with the team of AIPH University at Bhubaneswar, and over the coming years wish them all the best.
In 2008, Dr. Pinaki Panigrahi took a step forward and set up an institution to promote education, research, and hospital and community-based activities in the core fields of public health. This led to the birth of AIPH, the Asian Institute of Public Health, Bhubaneswar. The initiative ultimately achieved the level of a university in the field of public health in 2018 when a bill was passed in the Odisha Legislative Assembly. AIPH University, Bhubaneswar, the only public health university in eastern India.
Take the example of childhood vaccines. $1 spent on this saves about more than $16 on healthcare expenses later. Imagine if we implement all the tools of public health at hand, what will be the ramification on health and development of a nation?
Located in Bhubaneswar, one of India's fastest growing cities, the university has not only become a new age educational hub, but also a thriving community of scholars, educators, and innovators from around the world in the domain of public health and allied sciences.
I am delighted to know that Asian Institute of Public Health is turning into a state university. We have been collaborating with Asian Institute of Public Health and established Bactec laboratories in Ispat General Hospital, Capital Hospital in Odisha, KEM Hospital in Mumbai, as well as at AIIMS, New Delhi. I am also happy to know that various infectious diseases as well as chronic diseases and a program on antimicrobial resistance which can be covered under public health can be taken care by this university. AMR not only in human beings but also in agriculture as well as in animals, which is a big problem under One Health, can be taken care because this university has not only field areas, it also has lab as well as hospitals connected to it. I wish this state university all the best and we will keep collaborating in future endeavors.
AIPH University, Bhubaneswar offers career-oriented courses at PhD, Masters and undergraduate level in public health, biological sciences, healthcare management and allied health.
AIPH University has its origin from the Asian Institute of Public Health, which was established in 2008 with support from University of Maryland, United States and Government of Odisha. This is the second public health university in India and first of its kind in Eastern India. We have excellent faculty members to teach and carry out research, trained abroad throughout with good academic record. They have proven skill of teaching in postgraduate and beyond postgraduate level.
The university has performed collaborative research with faculty from major American universities and international institutions. The flagship programs offered by AIPH University, Bhubaneswar includes Master in Public Health, MPH, MSc in Applied Microbiology, Life Sciences, Zoology and Botany, Master in Physiotherapy, MPT, BBA and MBA in Healthcare Management. Apart from this, the university also offers many executive programs for the benefit of working professionals. AIPH University, Bhubaneswar attracts students from all over the country and provides the right platform to build them as the future professionals in the field of public health.
This university provides what I want exactly for my career development.
As a part of the admissions process, aspiring students attend the common entrance test and later the counseling to join the program of their choice. Public health, being an emerging field globally, promises massive employment opportunities in government, UN agencies, NGOs and the private sector.
The career opportunities of the graduates of this place and the requirements of the country at large and the society in particular, particularly the poorer sections of the society, these are inextricably connected. Public health is not just limited to medical graduates only, and it actually essentially encompasses scientists and statisticians, mathematics people, modelers and anthropologists and so on. AIPH actually has designed its courses in such a way that they are able to attract people from a variety of disciplines.
Today, when we talk about quality education and research activities in the subject of public health in India, AIPH University, Bhubaneswar comes to the limelight.
I've been coming to Odisha for about 9 years to work with students and faculty at the Asian Institute of Public Health. Odisha is a wonderful place to conduct epidemiologic research, from infectious disease to chronic conditions such as chronic kidney disease and cancer. And I look forward to continuing my relationship with the Asian Institute of Public Health, now AIPH University.
The university, which is currently operating from its city campus, is going to provide modern infrastructure and facilities to the students at its future campus near IIT Bhubaneswar, which is also a home to other national level institutions of India like NISA and CIPET. For more information on AIPH University, Bhubaneswar, visit aiph.ac.in.